Well, patients have been impacted a lot during this pandemic, especially patients with chronic diseases and patients who are not directly affected by the virus. But we were able to see clearly the link between infectious diseases, chronic diseases. This dividing for years have been there, and people wondering which one is more important. Shall we focus on non-communicable diseases that obviously are very important and causing lots of death around the world, or shall we continue investing in preparedness about infectious diseases? And at the end, we end up in a situation when I don't think anyone in the world was completely prepared for this outbreak, but actually the most affected ones are patients with chronic diseases with infection, because the highest mortality rates are among them. They were those groups where the weaknesses of the healthcare systems were obvious after and are still obvious during this epidemic, because we can see clearly where are the gaps in the systems to provide the care that the patients need, to provide the treatments that they need. And of course, from now on, I think the lessons should be learned, because we now see the situation. But I think for years we have to go back and learn our lessons and see what we have to change in the future. So it's not about being prepared on infections. It's not about being prepared on chronic disease. It's about prioritizing health as something that every government should recognize, not as just a cost, a cost as many governments would say, but this is investment in the economy. This is investment in the future of our societies. But what's more, health is not something that any single country can handle alone. And these are probably the next lessons that were learned. Guidance, coordination, and solidarity. These are probably three key learnings that we have to analyze in the future, how we improved in that.